Hi, my name is Jennifer Cox. I am currently a NICU nurse. I've been there for 3 years. I have also had 6 years of experience as a pediatric nurse. Today I'm going to be talking about less invasive measures of administering surfactant to preterm and low birth weight babies who are having respiratory distress. Right now, this is currently the method of choice for treating respiratory distress, particularly in low birth weight and preterm infants. Most infants born less than usually 34 weeks will require some type of surfactant within the first 2 hours if they score below 4 on the respiratory distress scoring system that we currently use. So there is growing research to support the change in administration process for surfactant because of the invasive measures in which we have to instill surfactant currently. So right now the current practice is if the infant scores below 4 within the first 2 hours of life, within 72 hours, they are administered surfactant through an intubation process, and that current protocol is called Ensure. So this includes early administration of surfactant with intubation. So they intubate first, they briefly ventilate, they supply the surfactant through the intubation tube or the ET tube, and they rapidly extubate, providing either an NPV, which is basically ventilation through nasal prongs, or a CPAP, which doesn't allow for respiratory rate, just constant pressure. So they will also sometimes, if the infant is doing very well, go to a lesser type of respiratory support like a high flow O2. But usually it's an NPV or CPAP after they extubate. They will provide this for a time until the infant proves that they don't need it anymore. So as far as these current studies go, they showed that 86% of the time, according to a 2019 study conducted in Germany, that this Ensure process was most effective when the infant was dosed if they scored below 4. So 86% of the time that this was being done, this was appropriate. Some of the drawbacks that they found in the study were because of the intubation process. Sometimes you would have issues with hemorrhaging or bleeding in the lungs. You could potentially have issues with lung puncture or other traumatic issues with the intubation process. So the process itself is the concern, not so much other areas that they would be looking at. Not the medication, just how they administer it. So the Ensure scoring in 2020, they studied 209 preterm infants, and during this examination, they looked at the need-based score to determine the administration of surfactant within the first 2 hours of life. So within the first 2 hours, the score was done. If the score determined that they were less than 4 on the scoring, then they would get surfactant. So they also found that within the predicted rate of administration versus what they actually administer, surfactant was within 5% of the points. So the algorithm, they feel, does appropriately predict who needs surfactant and who doesn't. The scoring system, again, is not the issue that we're looking at improving. It's the actual administration of. One of the proposed and currently being studied alternatives to ET tube administration of surfactant through intubation is called LISA. This is a more recent administration technique and is becoming more widely used in the NICU environments. So in 2019, the studies really started to come out with this. LISA stands for less invasive surfactant administration, and like I said, it's becoming a more widely used method. This uses a thin catheter that's inserted much like an ET tube would be inserted, but because it's a thin catheter, it does not require mandatory ventilation. You can go with a CPAP or an NPV, less invasive type of respiratory support while this is being done. So this thin catheter passes through like an ET tube would, and they administer surfactant through the thin catheter while CPAP or NPV is being administered. So this has shown to reduce incidence of IVH or hemorrhaging as compared to the control group that was receiving intubation and surfactant through an ET tube. An even less invasive form of surfactant administration is through a nebulizer. So if you've ever received a breathing treatment for asthma, either albuterol or some type of budesonide or another type of inhaled steroid through a nebulizer machine, this is the same process that they're experimenting with. And according to a 2021 study, and this is even more recent than LISA, the question that was being raised as to whether or not nebulizer administration of surfactant can prevent early intubation of preterm infants. Nebulizer administration would be the least invasive way to administer this, as the ET tube or thin catheter would not be needed to be inserted into the lungs. So there is sparse data and research at this point, but preliminary findings do indicate that the surfactant nebulization is promising in facilitating a drop in carbon dioxide pressure, as well as decreasing the need for required oxygen supplementation. So this is really hopefully where this is going to go. More research definitely needs to be done in order to make this an established evidence-based practice. The most promising one at this point that could really lead to an evidence-based practice is the LISA, or the less invasive surfactant administration. That's really is becoming more widely used at this point, and that's the use of a thin catheter instead of an ET tube. So in conclusion, there are established risk factors associated with the current practices of more invasive forms of surfactant administration, and the greatest risk is due to the use of an ET tube insertion and ventilation. Those risks include IVH, or effusion and lung collapse. And while scoring systems are in place to help determine which patients are most likely to benefit despite the risk factors of this type of replacement therapy, it is important to research the alternative methods to help to reduce the risk of complications while still providing the maximum benefit of these needed treatments. The articles that were presented in this presentation show that there are two possible improvements to the current administration technique that may become soon the new evidence-based practice, and that is the LISA, where they use the thin catheter to administer versus the ET tube, or the nebulizer, which is hopefully going to become proven to be the more effective and least invasive method. So while there still needs to be data to demonstrate over time, so far the research is very promising that this could become the new evidence-based practice. So one of the things that we looked at during all this research, and I was able to write multiple papers on before doing this presentation, is to look at how I examined the information that was being presented. I did put all of the articles through the CRAP test, which basically looked at the credentials, whether or not it was a reputable source, if they were, a reliable source of information. And I did make sure that each of these that are on this reference page do meet the criteria to be reliable evidence-based source material. We have to expand that a little bit because it's small, but I will be providing a reference sheet with a little bit easier to read references along with this presentation. These articles are within recent time frames. They are within the last 3 years, so they are not dated. And they provide non-biased sources of people who were researching and demonstrating this over time. Thank you very much for listening. Have a nice day.